for a tough month. Doctors and health officials have repeatedly pointed to December as a point where COVID patients could overwhelm our hospitals, stress resources, even have our frontline workers making some very tough decisions. According to our state's dashboard, the number of COVID-19 patients in our hospitals increasing to levels we haven't seen since July. ABC 15's Mike Pelton with a look at the effort to make it through a tough month.
We're about halfway to where we were in the summer, but that halfway is going to put a bigger squeeze on us because we're used to running at capacity at this time of the year.
Dr. Sam Durrani is the chair of the Honor Health Medical Staff COVID-19 Task Force.
When we're surging, quote unquote, that means we're stretching the hospital to its limits of capacity. So just like, normally an ICU patient would be one-to-one care, we can stretch our nurses with additional resources. We can stretch them to 1 to 3, okay? But that's not ideal care.
Dr. Durrani says the coming weeks could see a surge that has them operating at 125% capacity. He's concerned and hopes to avoid using crisis standards of care.
Absolutely horrifying to think of occurring in this country.
A dire situation that would have ethics teams, doctors deciding what patients get what valuable resources.
That is what we fear the most as physicians, not being able to deliver care and deciding who lives and who dies.
Down the street at Mayo Clinic, Dr. Ayan Sen says in his career he hasn't had to use crisis standards of care.
I've been in several disasters, volunteered for things like earthquakes and, prior experiences in some, major disasters, but never to a point where we had to make those difficult decisions.
And as COVID cases rise,
I'm worried, concerned, and, I would say exhausted.
The chair of the Department of Critical Care Medicine, he works directly with COVID patients and warns of long-term effects for many of those who do walk out of the hospital.
It's been surreal. We've taken care of a lot of sick patients here at Mayo Clinic and also in my past experiences, but never the volume and the acuity of illness that we are seeing.
Both doctors we talked to Tuesday urging you to wear a mask, social distance, help save lives. Mike Pelton, ABC 15, Arizona.